Indiana in the Morning is presented by First Commonwealth Bank. And in the studio with us, it's another installment of Meet the Physicians. I need a really good jingle for that. I don't have one yet. And me singing it would not be a good thing at all. Dr. Nazneen Billimoria is with us this morning from the IRMC Physician Group. Good morning.
Good morning, Todd. Thanks for having me.
You have not been on this air for a long, long time, huh?
Oh, no. I've been now here in Indiana for 3 years. I remember coming on the show way back when I'd been here, I think only a couple of months.
Yeah.
And it's been a great run so far.
Oh.
So I'm really glad to be back.
Well, we're glad of it, too. You are a surgeon.
I am. I am a general surgeon.
Mm-hmm.
And as I said, I started back here in October 2015. And I do all kinds of surgery. In the last year, we've had some exciting additions to our general surgery department.
Mm-hmm.
We started doing robotic surgery back in August last year, which has been a great service that we've been able to provide to our community. Recently, Dr. Dan Clark has joined our surgery group in June of this year. And Dr. Clark is our director of our breast center as well as of minimally invasive and robotic surgery.
Yeah.
And with Breast Cancer Month coming up, this is pretty exciting for us.
I would guess.
Yeah.
I would guess. Now, let's circle back to robotic surgery.
Yeah.
It's hard to believe it's been a year.
It has.
Wow.
Yeah. It really has. And, we've, unfortunately, I don't have the exact number of cases, but we have done over 100 cases at this point at Indiana. And that increases every day, every week. It's amazing the recovery that patients have after this kind of surgery. Because we've started doing procedures that we originally did in an open fashion. We're now doing it minimally invasive, and the recovery is just incredible.
Now, people talk about robotic surgery, and a lot of times they want to focus only on the abdomen. But robotic surgery has many different applications, doesn't it?
It really does. We don't do thoracics here, but thoracic surgery can be done robotically. Gynecology is done robotically, which, and urology. Originally when the robot first started several years ago, it was used more for gynecology and urology. And only in the recent, 5, 7, maybe even 10 years that it started sort of making its way over into general surgery. And now it's, things that we, as I said, we're doing in the open, old-fashioned way. Now the standard is to do it robotically, and it's great.
So think back to when you first got involved with robotic surgery. A lot of people would say, that's too intimidating for me. Here's my line. I've drawn it, and I'm not crossing it. You can't do that in your field, can you?
No, unfortunately you can't, because if you do, you're going to have a very limited practice, especially for someone like me. I'm about 7.5, 8 years into practice since graduating residency. And, if I just stay static in what I do, I'm never going to grow as a physician, as a surgeon. And, I won't be able to offer our community with what's out there. Yeah. People don't need to go down to Pittsburgh to have their hernia repair done robotically anymore. We do that here. We do colon resections robotically, which is amazing because patients go home in 2 days after surgery.
Wow.
So really, it's a service that we've been able to provide here, thanks to Dr. Andy Billen, who was really instrumental in getting our robot here at IRMC with help from our Indiana Foundation as well.
Was it easy for you, and not just you, but as an entire staff, the robotic surgery staff, was it easy to adapt to it? Did it take intensive training?
It took a lot of intensive training. For myself and Dr. Billen, who went through the training, as well as Dr. Gudetti, this was several hours of simulation and practice on the robot even before we ever touched a patient. And then after several hours of that, and I'm talking, several days worth of hours here.
Sure.
And after that, we had to go to a training course in Atlanta. at the Intuitive facility over there, who is the company that makes the robot. Mm-hmm. And they basically have to sign off on us saying that, yes, we are okay to now operate on patients. And then we came back, and last August, I believe it was August 3rd, 2017, Dr. Billen did our first robotic cases here, and then I was 2 days later on August 5th. And actually, Dr. Clark was my proctor for when I did my first robotic cases here. So a little bit of history there, and now he's part of our group here, and we're so happy to have him.
I remember when he came in here, he said he walked into that the operating suites at IRMC, and then he saw your skill, and he said, "Wow, I got to be a part of this team."
Yeah, I mean, we are so lucky, really, really lucky to have him here, and he's been a great asset to our group and even to our community.
We're talking with Dr. Nazneen Billimoria this morning in our Meet the Physician Group, which she, of course, is with the IRMC Physician Group, and you mentioned that October is Breast Cancer Awareness Month.
Yes, it is. And, breast cancer, it is the most frequently diagnosed cancer amongst women, and it is the leading cause of cancer death amongst women. At IRMC, as I mentioned, Dr. Clark is the director of our breast center, and we are working towards becoming a part of the National Accreditation Program for breast centers. This is just an accreditation for breast centers to say that we are good at what we do, and it's offered through the American College of Surgeons, and we already do a lot of the things that they require. Now it's just a matter of putting it on paper and saying, here you go. Our breast care starts from screening mammograms, going all the way through surgery, and then post-operative care, and then post-treatment care as well. And we are also in partnership with the UPMC Hillman Cancer Center, which we are very lucky to have. And so there's no reason for anyone in our community who has been diagnosed with breast cancer to go into Pittsburgh, because we have everything available to them here. We have a women's imaging center, and depending on what guidelines you look at for breast cancer screening, and this is an hour talk by itself, but typically it is recommended that any woman about 40 years or older have an annual mammogram. About 1 in 8 women will develop an invasive breast cancer in their lifetime. This year, in 2018, there have been over 260,000 invasive cancers that will be diagnosed, and 64,000 non-invasive breast cancers, and almost 41,000 women will die from breast cancer. So it's prevalent. It's very relevant to all of us, and all you women out there who are 40 years old and have not had that first mammogram. I can't encourage you enough to have it done. You can have a self-referral at our Women's Imaging Center. And the number for them is 724-357-8081. And we have an excellent team of radiologists, technicians, and then if women need surgery, Dr. Clark and I are committed to providing our community with the service, and we are dedicated to doing this. Our oncology team, like I said, is from the UPMC Hillman Cancer Center. Dr. Ramanini and Dr. Evans are both excellent at what they do. So,
you as a surgeon know and can tell women this much better than I, that surgery is not the automatic, absolute first choice when someone is diagnosed with breast cancer, and particularly if they're diagnosed early enough. In fact, there's a very good chance that they won't even get to that point of surgery if it's caught early enough. Is that a correct way to put that?
Well, actually, if breast cancer is caught early enough, actually surgical resection is what we do first.
Oh, okay.
And then they might not go on to require any chemotherapy or things like that. But usually surgical resection, if it's caught early enough, is generally all they need. Now, depending on what surgery they choose, whether they choose to have breast conservation, which means we only remove a portion of the breast that has the cancer versus removing the entire breast, versus a mastectomy, which is removing the entire breast, they may require post-operative radiation, which is not nearly as bad as chemotherapy. But caught early enough, all they would require is potentially surgery followed by radiation or surgery itself.
And of course, one of the things that is exciting, I'm sure, in your world is that what used to be a death sentence, breast cancer, people automatically thought, that's it, I'm done.
Oh, absolutely.
Never more.
Absolutely. Since 1989, the rates of death from breast cancer have definitely been decreasing. The largest decrease is seen in the age group under 50 years old, which is why we strongly recommend that women starting at age 40, if there's no family history, that's when you start having your screening mammograms every year.
Okay, so we're talking with Dr. Nazneen Billimoria today, and boy, we could go on for a long, long time. There's plenty to cover, plenty of ground to cover with you. When people come to see you, generally it's by referral from someone else, but you do keep office hours, correct, for general purposes?
Absolutely. Personally, my office hours are Monday afternoon, Tuesday afternoon, and all day Wednesday. All of the other physicians have, there's one of us in the office every day of the week. And most of our patients do come to us by referral, but we have also have patients just call in and say we need to be seen for a certain issue. And we are able to get them in within a day or two. So yes, it's very easy. If someone does need an appointment, the number to our call center is 888-452-IRMC. So if you just give them a call, we will be happy to see you in our office.
And it's wonderful that you're in these amazing technologically advanced operating suites, and that you have a team around you that is able to address practically any need.
Yes. That has been one of the perks of working here. Our operating suites are really beautiful. In fact, when I interviewed here 3 years ago, a little over 3 years ago now, the operating rooms were still not completely ready, but they refused to show me the old operating rooms because they said it wouldn't matter anyway. So
you had nothing to compare.
I had nothing to compare, but they are indeed beautiful.
Well, we thank you for coming in and spending some time with us today. We appreciate it.
Well, thank you so much for having me.
Dr. Nazneen Billimoria with us here this morning on the Voice of Indiana County, WCCS AM 1160 and 101.1 FM.